medical terms, there's no equality at all. Up until 1993, women could not be part of medical testings. That's only then they specifically required women to be part of medical testing for any diseases. Other than that, women are just considered mini men and are given just smaller doses of medications and are not treated for the diseases.
Okay, so I can give you two rebuttals to this argument.
Please.
The first rebuttal would be, it's very dangerous to experiment medically on somebody who has the potential to be pregnant. That's the first rebuttal.
I've seen that argument, but then
it's a valid one.
It is a valid one, but then it's
right.
like you can't really learn about what the bodies need.
Okay.
Then.
So then the second one is it really like some sort of privilege to be in such financial dire straits that you're going to get experimental drugs pumped into you?
So it's not about the experimental drugs. It's about the fact.
Do you think that's a male privilege, that males are privileged because they get medically experimented on? Do you think that's evidence of, or do you think it's actually a privilege that we actually raise up women to such a degree that we want to protect them from being medically experimented on?
Okay, I can see how you may think that, and from that perspective, I can see the viewpoint. However, from a perspective as a chronically ill woman, not a single male doctor could ever diagnose me. And in fact, I've been misdiagnosed so many times. I've been giving so many wrong medications that have only worsened my symptoms. So it's like, specifically the medical care, and I'm only talking about in the United States because that's what I've had the most issues with. It wasn't literally until last year that a female doctor actually was able to diagnose me and prescribe me the things and in the way that actually helped me. So, and only because she experienced those things herself and she had to experiment on herself. So it's like just the overall system of the whole healthcare system in America is just terrible.
And then I think Andrew's actually made this other argument too, is that due to women's fluctuating hormones that tend to fluctuate more than men, whereas men are a bit more constant.
Exactly.
Right, but it's better to test it on them for that reason also.
Except then it affects women in a different way though, because of their fluctuating hormones, because taking some
but looking at the totality, it's still not clear to me if it's some sort of benefit to, like, it's some women are oppressed because
I didn't say women are oppressed.
Well, then women are disadvantaged because they don't get medically experimented on.
No, women are disadvantaged because they are less likely to be diagnosed with with the condition that they actually have. They're more likely to be.
Is there any facts or data about that?
Yes, actually, there's plenty.
Well, there might be plenty of data that might suggest that there's more medical experimentation on men. However, it's not clear to me. Hold on, let me finish. It's not clear to me because of this that somehow it translates to if a drug is passed and it's been tested more on men, that women are going to have like disproportionately more negative health outcomes because it wasn't tested on them as much.
Well, this is kind of silly anyway, because when you're talking about testing standards, you have to follow what are called ethical practices. So if there's drug experiments which are going on, it's going to be voluntary. So what they do is they do paid voluntary drug testing. So what will happen is you take part in some sort of experiment. College kids do this all the time for additional money, sometimes for 21, 31, 40 days, sometimes a year. Men are more often the people volunteering.
I volunteered in college.
Yeah, okay, but that's not what, it doesn't matter if you volunteer. What I'm saying is that men are more likely to volunteer. Do you know what more likely means?
Yes, I do understand. Yeah. However, it's like, I'm not talking about specifically the testing. I'm talking about the entire system and what the doctors have been taught in the past that it still moves through today. It wasn't until 1993 that women were required to be at least like 40% a part of
Is
the
this your
testing.
best example of inequality between men and women?
That is not my best
Here,
example.
give me your best example, because these small, minor examples are kind of uninteresting to me.
Okay, well, except as I've said, I'm not going to argue on it. I was just wanting to know everyone's opinions because I'm just simply confused. Why is being equal as human beings?
Why 30 years ago there was disproportionate medical testing being done?
Over 30 years ago, and then even still right now, there still are, because a lot of doctors are still following through with that.
Okay, give me a better example.
Example of what?
Inequality between men and women.
Except I told you that I only wanted to talk about the medical.
That's the soul.
Okay,
That's your
I'm willing
soul.
to talk about the medical.
I mean, we've already.
Because you have personally have mentioned that you have heard a million things before. So I'm not going to tell you anything that you haven't heard before and that Andrew hasn't heard before. And I'm not here to argue about it. All I know is
Okay, so
my experience and the experience of a lot of other women who have gone
Right,
through
so you
similar
said,
issues.
You said 30 years ago, though, so that's quite a while ago.
So actually, only recently, Biden, like in 2024, has passed that it has to be 50% of the females in the testing, and actually taught, and
Yeah, that's a regressive policy. So this is a
Well,
completely
as a
regressive.
woman who is
it's a
chronically ill, I
regressive policy
disagree.
to then introduce your political bias into scientific testing. The thing
It's
is
not
that
it's not about politics.
not all of these experiments, for instance, inside of medical fields, would even require a demographic of 50% of it to be women, or 30%, or even 10%. It's all experiment specific, and not only
it
that,
is.
when you're doing medical experiments, try to remember that you can adjust for these other variables. You can find men, for instance, who have hormones which are similar to women due to all sorts of different reasons. They
Except,
can
as
have
you
the
said,
same
it's
amounts of
voluntary.
estrogen as a modern woman. And so the experiments that you're talking about do not demonstrate a social bias towards women. There's other factors for why this occurs. One such factor is they don't volunteer as much because of ethical testing standards. They just don't volunteer as much. They don't give blood they don't do any of this stuff as much.
Okay.
How would that be biased? That seems like women are basically selecting themselves out of that.
Also, I just want to piggyback on Andrew here really quick. So you said that Biden, it has to be 50-50 with the medical experimentation?
I'm not 100% sure.
That's what you said.
I've read the document. I'm not sure if it's a proposed bill or
Would you
if
be in
it's
favor
already
of that
passed.
proposal?
If you want
I would, actually.
Okay, so let me ask you a question on that. So assuming there's a medical experimentation, a case study, whatever it is, but they're just incapable of finding a 50-50 split, wouldn't doing this prevent medical experimentation from even occurring? So it would prevent advancement in medicine.
So no, because
okay. If a study
let me
could
answer
not-
that. So it wouldn't, please, because you've asked me.
Go ahead.
So it wouldn't, because it requires. But the thing is that if you can't find them, you can still do the testing. You just cannot use that same findings on the opposite person. You can only use the findings that you found on that type of person. And that's the key point. The fact that women have been considered literally mini men and just been given smaller doses of medication that could potentially harm them and have harmed them in the past, that male doctors misdiagnose women all the time.
Right, but this precise example you've given me, I can just turn around and say, for the decades or centuries, maybe not, well, they've been doing medical experimentation for a long time.